E. coli and Salmonella are two well-known bacteria that can cause foodborne illnesses in humans. While they share some similarities, they also have distinct attributes that set them apart. Morphology. E. coli, short for Escherichia coli, is a gram-negative, rod-shaped bacterium. It belongs to the family Enterobacteriaceae and is commonly found in the intestines of humans and animals. Salmonella, on the other hand, is also a gram-negative bacterium, but has a slightly different morphology. It is also rod-shaped, but can be motile due to the presence of flagella. Both bacteria have a cell wall that helps protect them from external threats. Transmission. E. coli and Salmonella can be transmitted through various routes. E. coli is primarily transmitted through the consumption of contaminated food or water, especially undercooked ground beef, raw vegetables, and unpasteurized milk. It can also spread through person-to-person contact in settings like daycare centers or nursing homes. Salmonella, on the other hand, is commonly transmitted through the consumption of contaminated food, such as poultry, eggs, and dairy products. It can also be transmitted through contact with infected animals or their feces. Symptoms. Both E. coli and Salmonella can cause gastrointestinal infections, but they present with slightly different symptoms. E. coli infections often lead to symptoms such as abdominal cramps, diarrhea, which may be bloody, nausea, and vomiting. In severe cases, it can cause a condition called hemolytic uremic syndrome, HUS, which can lead to kidney failure. Salmonella infections, on the other hand, typically result in symptoms such as diarrhea, fever, abdominal cramps, and sometimes vomiting. While both bacteria can cause severe illness, E. coli infections are more commonly associated with severe complications. Treatment. When it comes to treatment, both E. coli and Salmonella infections require medical attention. However, the approach may vary. In most cases, E. coli infections resolve on their own within a week without specific treatment. It is crucial to stay hydrated and rest during this time. Antibiotics are generally not recommended for E. coli infections, as they can increase the risk of complications. On the other hand, Salmonella infections may require antibiotics in certain cases, especially if the infection has spread beyond the intestines, or if the individual is at a higher risk of severe illness. It is important to consult a healthcare professional for appropriate diagnosis and treatment.